Doctors nationwide are grappling with a surge of walking pneumonia cases. According to data from CBS, the number of 2 to 4 year olds diagnosed after visiting the ER for a pneumonia-related illness has jumped from 1 to 7% in the last 6 months alone. Symptoms include sore throat, extreme fatigue, chest pain, low-grade fever, and headache. And pediatrician Dr. Cynthia Cross is joining us here on the couch to talk about the uptick in the flu, the walking pneumonia rather, and also the RSV, right?
RSV, yes.
Oh my goodness.
Yes.
Okay, so first of all, let's get through the flu. You were just talking about a statistic about how they're younger, and can you compare the nationwide data to what we're seeing here?
So we were talking about mycoplasma. So for the national data, we're following that. We mirror that, and we're seeing it in younger kids. You know, mycoplasma is the cause of walking pneumonia.
What is that?
Right, yeah. It's an atypical bacteria. It's treated with a different class of antibiotics.
Wow.
And we don't typically see it in the 2 to 4 year olds, but we have seen an uptick in that, and none of us really understands exactly why that is. Now, in years past, we didn't necessarily test for it, and now there are new tests that have that as part of the panel. And then we were seeing kids whose illness mirrored what we would see with mycoplasma. So the cough lasts a bit longer. It usually starts out a little bit slower than a regular bacterial pneumonia, which gives you that high spike in fever, and your symptoms get worse over about a 24 or 48 hour period of time. This kind of lingers. It also has a longer incubation period. So very, very interesting. And the recommendation for treating community-acquired pneumonia is to start off with something like high-dose amoxicillin. Well, that won't work on this particular bacteria.
Wow, and so when do you know that it's time to take your child to the doctor? Like, I mean, is this something that you do definitely take them to the doctor, or you know, what happens?
So it's not something like a virus that will go away with just symptomatic treatment. So if your child is having chest pain or wheezing, or the cough is persisting and getting worse, it's a good idea to go ahead and get them checked out. Now, not every kid needs a chest x-ray, not every kid needs the test. Some providers feel perfectly comfortable looking at a kid and saying, you know, this really behaves like mycoplasma. Let's just go ahead and put you on a Z-Pak. We've all heard of the Z-Pak.
Yes, the Z-Paks.
Yeah, Zithromax is the drug of choice for this. There's some other drugs to use if that one doesn't work, but that's typically the course of action.
Okay, and now from walking pneumonia to RSV.
Yeah.
What is RSV, and what is the difference with the symptoms and everything?
RSV is fun. It's one of the viruses that I have a lot of respect for, but I don't like it at all. That RSV stands for respiratory syncytial virus. It's up there on our screen. Younger kids are particularly at high risk because it starts off looking like a cold, then it makes its way into the chest. It can cause wheezing, pneumonia, and the babies tend to fatigue because they really work hard to breathe with RSV. So some of those kids do end up in the hospital on supplemental oxygen. They need help suctioning and clearing their airway. But the good news is there are vaccines for RSV. Yours truly here took one because at the other end of the age spectrum, folks are also at risk. So if you're, say, an elderly grandparent or great-grandparent and you're going to be around those grandkids, probably not a bad idea to, along with your flu vaccine and the pneumonia vaccine and the COVID vaccine, to get the RSV vaccine.
Right.
Now, that one you don't have to get every year. They haven't decided how often we'll need a booster for the RSV vaccine. And there are also treatments for younger babies, and they're even treating pregnant women.
And this is something you do go to you do bring your child to the doctor, or your senior citizen.
Yeah, I would.
Okay.
Yeah, especially if your child is having trouble breathing, and sometimes you can see it below the rib cage starts to sink in when they breathe, and above the collarbones and above the sternum there, you'll see their little chest just really working hard. Fast, hard breathing, always a reason to get them looked at. Or if they're not feeding well, because the younger kids can't go very long without feeding, they dehydrate quicker.
Yes, and so not only are you at UT, you are also at Le Bonheur, and so I know that you guys have a information landing page there that we can check out.
Our webpage, yes, absolutely.
Okay, lebonheur.org.
And the CDC.
Yes, okay, wonderful. So we really appreciate you coming in every month and just keeping us updated on what you're seeing
My
with
pleasure.
your patients.
Yes, absolutely.
Wow. All right.
Yeah.
Thank you,
All right.
Dr. Cynthia.